Which of the following is not an obstructive cause of mouth breathing? Now, mouth breathing as a habit usually develops whenever there is going to be increase in either resistance or some sort of an obstruction to the air that is passing through the nasal passages. So, a newborn child is an obligatory nasal breather. Okay, that is, he breathes only through the nose. It is only when the demand for the air is going to increase. Okay, so when there's going to be increased demand for air because there is reduced airflow. Okay, there is reduced airflow through the nasal passages is when the person is going to start adapting, okay, and start breathing through the mouth, okay, in order to meet the demands for the increased airflow. So this is usually going to happen in those situations where there is some sort of an obstruction of the nasal passage or when there's increased resistance to the airflow through the nasal passages. Okay, now Finn is the one who has actually classified the types of mouth breathing. So Finn, in the year 1987, he classified mouth breathing into 3 types. So according to him, type 1 is obstructive. Okay, that is a person is going to breathe through the mouth because there is some sort of an obstruction in the flow of air. Okay, this could be either partial obstruction, complete obstruction, or increased resistance to the normal flow of air through the nasal passages. So it is because of a necessity that the child is breathing through the mouth and not because of a habit. Okay, so the causes of obstruction. So the causes of nasal obstruction can be because of various reasons. Okay, they could be temporary or they could be more developmental. So it could be because of any deviated nasal septum, okay, or any nasopharyngeal deformity. They can be because of nasal polyps that have developed. Okay, so any pathological cause, enlarged nasal turbinates. Okay, so if the nasal turbinates enlarge, that also could cause obstruction of the passages. Okay, some temporary causes could be allergic rhinitis, okay, which causes engorgement of the blood vessels in the nasal mucosa, which causes their obstruction. It could also be because of enlargement in the adenoids or tonsils. Okay, so enlarged adenoids and tonsils can also cause some sort of obstruction of the nasal passages, or if there is any other tumors of the nasopharyngeal passage, okay, or any obstruction in the bronchial tree or larynx, etc. So any of these factors, okay, which cause obstruction, if they are going to be present, or even those causes such as a narrow maxilla. Okay, so when there is a narrow maxilla, this is also ultimately going to reduce the external passages of the nasal cavity, right? So this is going to increase the resistance to airflow, increase resistance to nasal flow. So all of these are going to be examples of obstructive type of mouth breathing. Okay, so this is because there is some sort of obstruction or increased resistance. The second type is the anatomic type. Okay, in the anatomic type, what he said was, this is because there is a short upper lip. Okay, so the upper lip is short because of which there is incompetency of the lips. Incompetency of lips, because of which the patient is breathing through the mouth, because his mouth is not closing completely because the lips are short, which is why he's breathing in through the mouth. Now, according to Prophet, this is not something that is true, because according to Prophet, that even if there is no competency between the lips, it is possible for the person to breathe through the nose, because the seal in the oral cavity can be developed by placing the tongue against the palate. Okay, so although there may be some sort of lip separation or lip incompetence, this is usually seen in children. Okay, it is not necessary that they may be mouth breathers. But if there is mouth breathing habit present because there is a short upper lip, then that is an anatomic anatomic type of mouth breathing. Okay, and the third one, that the third type of mouth breathing according to Finn was habitual. Okay, so here in the habitual type of mouth breathing, he suggested that it is usually seen in those children who will continue to breathe through the mouth as a force of habit. So it could have been that there was some obstructive cause because of which the child started breathing through the mouth. But even after the obstruction has been removed, the child will continue to breathe through the mouth as the force of habit. Okay, so this is the habitual type of mouth breathing. Other types of mouth breathing that can be seen are obstructive sleep apnea, or because of or they can be associated with other habits such as thumb sucking, etc. Okay, now in this question we have been asked which is not an obstructive cause. Okay, so deviated nasal septum is obstructive. Okay, narrow maxilla is increased resistance, which comes under obstructive cause, and obstructive adenoids can also block the nasal passage. So the one that is not an obstructive cause, okay, is a short upper lip, because a short upper lip is an anatomic cause for mouth breathing. Okay, not an obstructive cause. Now, some of the other important features that you should know from the topic of mouth breathing are the clinical features. Okay, so the clinical features of mouth breathing are very, very important because they are usually asked in the exam. Okay, especially the adenoid faces. The adenoid faces or the long face syndrome. Okay, this is usually asked in the exam commonly. So the clinical features are very important. Okay, they could also ask you this as an image based question, where they can give you the image of a person with adenoid faces and ask you to identify the habit that is seen in this patient.